For me, multitasking is not doing 4 things at once. It's doing one thing that accomplishes 4 goals. And
very nice. I like that. Do
yes.
you mind if I use that?
Now, I steal it. I
Okay.
tell everyone, steal all my ideas. They can be yours. I'm interested in making the system better. Okay. So, your paperwork problem, we have everybody filling out assessments forms that are normally done by sampling. We're doing census instead. If we did sampling and we got a university professor to get his graduate students to work on doing the sampling and doing this testing, we would bring them all into the public mental health and health services, and it would cost a fraction of what it costs now. We'd have much better data, and we'd have much happier people. And I've been saying this for years, so if I'm talking to someone who's willing to hear, I'm really happy about that. The other thing is that I've told Robin before that she's a half full person and I'm a half empty person. So we see the same thing, and I see it half empty and she sees it half full. She sees the progress we've made, I see where we need to go. Okay, so in terms of that, on peer services, we are nowhere where we need to go on that. Cher has just gotten a grant from OSHPD, which is a state training and development thing, to train peer workers in advanced peer services across the county, across the state. And LA County gets 100 of those slots for free that we need partnership with to fill so that we can train people to do the things that peers can do that actually work, that are evidence-based. Because there's a lot of evidence-based stuff, and by and large the department ignores the evidence-based peer stuff, like self-help support groups, like critical time intervention done by peers, which is a fraction of the cost of it done by professionals, things like that. There are so many things that peers would get meaningful jobs out of that case managers hate doing, okay? The things that they hate the most. And what I've seen done in the past is where you take people's jobs and you ask them what they like to do and what they don't like to do, and then you find somebody else willing to do those other things. Usually the things that we like doing are the things that are at our highest achievement level, and then you take those and put them down to the other place, so that you take them and give them to people who have less education but who are more motivated to get it right. So that's another idea. Okay, so we need more peer services. We've got this opportunity to get a lot of people trained up to snuff so that we can have much better peer services. And we need to be looking at how we can remove the things that case managers, that's what we did when we got case managers. It used to be the psychiatrist did everything. And then we recognized that we could have a case manager that did the things that the psychiatrist didn't like. Well, it's time to look at what the case managers are doing that they don't like and get paraprofessionals to be doing those. Finally, if there was one thing about the mental health system that would, if we changed it, would immediately make everything better, it's stop controlling. This idea that we need a locked place. This idea that we're going to, instead of persuading people to come, we are going to put consequences if they don't come. That whole concept, Americans don't like to be controlled. The reason that we pay $150,000 a year to keep people in jail is because we want that power and control. That's what we're paying for, the ability to do that control. And if we took the control out of the system and made it interesting for people to come to, and speaking to Dorothy Banks' issue about people alone in their Section 8 apartments, we have multiple studies now that show that people who go into Section 8 housing, their mental health declines because they are isolated. The evidence-based best practice is shared bedrooms, 2 people per bedroom. Yet we can't do that because we believe it's wrong. We believe it's wrong, even though the research shows that the person in the single apartment alone, mental health is getting worse. So we need to be open to what actually works rather than what we think is working. So those are my points.
Can I just, Lawrence, we're gonna take one more question, and, Lawrence?
Thank you. Yes, I